welcome. Thank you for tuning in to our video today. My name is Mari Gali, and I am an oncology acupuncturist and doctor of acupuncture and Chinese medicine. Today, I want to talk to you a little bit about integrative medicine and oncology supportive care. We're going to talk about a few different modalities and resources of where you can find them and how it might help you navigate treatment. So first, we'll go into what is integrative medicine. And then we'll talk about manual therapies and body-based practices, some ancient medical systems, and then in part 2, we will cover energy therapies and mind-body techniques. What is integrative medicine? It's defined as the healing-oriented medicine that takes account of the whole person, including all aspects of lifestyle. So this emphasizes the therapeutic relationship between practitioner and patient. It's informed by evidence, so we use evidence-based medicine to create our treatment plans, and we make use of all appropriate therapies. So we might not use every single modality in integrative medicine to treat you, but we will choose what is appropriate for your care. And one thing that I think it's important to focus on is that integrative medicine treats the whole person, not just the disease. The basic principles of integrative medicine include a patient and practitioner working together in the healing process. So the patient and the practitioner both have equal roles in creating and developing your treatment plan. We use evidence-based medicine, and this is applied as well for our treatment plans. And what is evidence-based medicine? This is when we apply research, our clinical experience from the practitioner, as well as taking into account the individual patient's needs and lifestyle, quality of life concerns. So we take that all together to be able to create a treatment plan to help you navigate whatever symptoms, side effects, or treatment that we need to work on. Integrative medicine also accepts both conventional medicine and complementary medicine. So this means we're not negating Western medicine completely and only working with alternative medicine to help heal you, but rather we are working both with your oncologist or primary care physician from a Western medicine perspective, as well as using complementary medicine modalities. Practitioners work together to provide whole person care in order to promote health and wellness while treating illness. So an example of that is I'm an acupuncturist, an oncology acupuncturist, and I will work alongside your oncologists, your nurse practitioners, physician's assistants to make sure that I am treating XYZ symptoms while the oncology team is treating cancer. There are many modalities that are under the umbrella of integrative oncology, and some are physical therapy, occupational therapy, exercise and sports science, acupuncture, massage, reflexology, nutrition or dietetics, Reiki, aesthetics, aromatherapy, counseling, and meditation. So we're going to cover a few of these today. And one thing to note that all of these practitioners would have advanced training in oncology care. So getting into manual therapy, I want to talk a little bit about reflexology and oncology massage. Oncology massage. So massage in general is defined as by the American Massage Therapy Association, that it promotes health and well-being by way of soft tissue manipulation and movement of the body. I'm sure many of us understand what massage is, or maybe we've had a massage treatment before, but oncology massage involves therapists who have quite a bit of advanced training in oncology care and how to keep you safe while receiving a massage. And this will help while you're going through treatment or post-treatment with musculoskeletal pain, lymphatic support, scar tissue, stress, anxiety, sleep. The list goes on how oncology massage can help you. And there are so many resources here in Austin to find an oncology massage therapist. One great resource is the Oncology Massage Alliance. They are a nonprofit group of individuals who do have the advanced training in oncology massage to ensure safe practices. There's a list of individual practitioners as well on their website. The Cancer Rehab and Integrative Medicine also has oncology massage therapists, as well as the Cancer Wellness Center here in Austin. Nationally, and you'll see the Society of Integrative Oncology mentioned a few times in this presentation, the Society of Integrative Oncology is an organization nationally, and there are members all over the world that have advanced training in oncology care and have work in order to provide uh, integrative oncology practice. So on their database, you will see oncologists, physical therapists, nutritionists, but there's also massage therapists who are members. And if you or someone you know do not live in Austin, but you would like to find an oncology massage therapist, this is a database that would be worth looking into. A few tips when finding an oncology massage therapist, because after treatment, if you've had surgery, if you've had lymph nodes removed, you really do need someone who understands the lymphatic system in the body and oncology treatments and how it may affect your soft tissue, skin, muscles, long term. So finding someone who has advanced training in oncology massage is very important. And someone who really understands the lymphatic system and risks involving lymphedema. And lymphedema is a whole other topic of conversation, but I can get you resources for that as well if you have any questions. There are also many oncology massage therapists who are manual lymph drainage specialists. All right, so reflexology. Reflexology is the practice of using pressure points and massage on specific points on the hands and feet to support the mind, body, and treat body symptoms and systems. So there are many points on our feet that can be pressed on or massaged in a specific way to treat various symptoms that you're going through. So I refer to reflexologists often to help with things like nausea, neuropathy, stress, sleep issues, the list goes on. Let's see here. And there are multiple reflexologists here in Austin, Texas. Many massage therapists will have advanced training in reflexology. It does require advanced training. It can take up to a year to receive the certificate and training to be called a reflexologist. And if you need anyone specifically in your region, please let me know. There were so many to list on this PowerPoint today, but they're quite easy to find in the local Central Texas area. So body-based practices, physical therapy and exercise. We all know exercise is actually very important during treatment, after treatment, and research recently has shown that if you can stay active during or even after treatment, it decreases the chance of recurrence in cancer. So this is something that we stress a lot in our clinic. For physical therapy, I'm not going to touch a lot on this because this is widely known, accepted in Western care. It's practiced in integrative oncology clinics nationally. Physical therapy, I will suggest that you find someone who does have advanced training in oncology physical therapy or manual lymph drainage physical therapy. Most cancer centers and hospital clinics will have a physical therapist or multiple that have advanced training in oncology care. And like I said, exercise, and that's just finding something that resonates with you. It doesn't have to be cardio for days or needing to train for a marathon, but just making sure that we are moving and we're gaining strength as we navigate treatment and beyond. I want to talk a little bit today about yoga, which is one specific exercise that we can all practice. Yoga originally was practiced in India. It has many forms, styles, applications, and is practiced all over the world. There's chair yoga, yin yoga, which is much more calm, more stretching and staying in one position, and then breathing into the next position. And then there's flow yoga, which has a little bit more movement. And yoga actually is involved in evidence-based research. Research shows that the practice of yoga has many aspects in oncology support. There's energy, range of motion, strength, stress, and sleep. Yoga has shown to improve all of these. So I do want to reiterate that many cancer centers all over the country offer yoga classes, really encourage this when guided through a trained oncology yoga practitioner. They can be incredibly helpful for you. And there's something for everyone. If you are, as far as mobility goes, you're still healing from whatever treatment you may have just gone through, there's chair yoga where you are seated and you can do gentle movement. Yin yoga, like I said, is much more gentle and kind of works our way up to something more like flow yoga, etc. Um, and there's so many resources, especially here in town. Joy Boots for cancer survivors. Kelly Inselman offers a weekly yoga class online, and the Moving Beyond Cancer Collaborative offers 3 yoga classes weekly, 1 chair yoga, flow yoga, and 1 yin yoga. And Cleveland Clinic, this is just one one clinic example, but Memorial Sloan Kettering, Dana-Farber, UCSF, the University of California, San Francisco Cancer Center, they have wonderful online resources, free for all who want to participate, of yoga classes. And even YouTube has wonderful videos. A few tips for yoga: be sure to have clearance from your medical provider prior to practicing yoga or any form of exercise. And talk with your yoga instructor. These Zoom classes that are offered locally, they are live, so you can chat in with your practitioner or your exercise yoga instructor and ask them questions prior to class, or let them know, hey, I might need modifications for XYZ, and they'll be sure to provide that. Ancient medical systems. Now we are going to shift and talk a little bit about acupuncture and traditional Chinese medicine. So this is a lot on the slide, but we'll get through it. Acupuncture and traditional Chinese medicine. Acupuncture is the insertion of fine needles in specific points of the body to create a response from the nervous system. So there's about 550 acupuncture points on the body, and each one does something a little different. And acupuncturists and traditional Chinese medicine practitioners will develop a point protocol to treat something very individual for you. It originated over 3,000 years ago in China. And today, oncology acupuncture actually has a wide array of research done here in the States and worldwide, showing that it can help with very specific symptoms associated with oncology care. And we'll get into that a little bit more in the next slide. And traditional Chinese medicine is actually an umbrella of study that acupuncturists we study as well. So in the state of Texas, the study of TCM, which is traditional Chinese medicine, and acupuncture is what is taught together in order for us to get our licenses. So we have to pass 4 national board exams in acupuncture, herbal medicine, biomedical science, and the foundations of Chinese medicine. And traditional Chinese medicine includes acupuncture, which is what we're all really quite probably most well-known practice, Chinese herbal medicine, gua sha, which is it's a scraping tool, cupping therapy, moxibustion, qigong, and tai chi. We will talk about that in the second series. Eastern nutrition and food therapy, Tui Na, which is like a Asian bodywork or targeted massage, and medical qigong. So if you are in Texas and you go to see a licensed acupuncturist, they have training in everything that I just listed here. And I think acupuncture is probably what is used the most. For oncology acupuncture and acupressure, symptoms and side effects that are treated often are fatigue, hot flashes, musculoskeletal pain, neuropathy, nausea, vomiting, diarrhea, constipation, anything GI related. Oncology acupuncture has shown research to help. Insomnia and stress, anxiety, depression, as well as like the foggy mind and mental clarity issues that may go along with treatment. Some tips and resources for acupuncture. Locally, there are oncology acupuncturists who have advanced training in working with oncology patients. Ms. Schreiber is a licensed acupuncturist. They are at the Cancer Wellness Center, and they're absolutely wonderful. And then myself, my name is Mari, and I'm at the Cancer Rehab and Integrative Medicine. There are so many acupuncturists here in town. I do recommend finding someone who has advanced training in oncology acupuncture so that there is knowledge in the treatment plans that you've had from a Western medical perspective, and then how acupuncture can help you navigate that treatment. I would, for some tips, just ensure that your practitioner is a licensed acupuncturist. So they would have LAC at the end of their name. They've completed the national board exams, and they are licensed within the state that you are living right now and receiving the treatment. Nationally, back to the Society of Integrative Oncology, there's a wonderful database and so many acupuncturists that are listed here. Down in MD Anderson, they have acupuncturists. Dana Farber, the Cleveland Clinic, has at least 6 oncology acupuncturists on their team. Memorial Sloan Kettering has a wonderful group of oncology acupuncturists as well. And the list goes on nationally. And if you ever have a question and trying to find someone or find someone in your area, please feel free to reach out, and I can help you navigate that. So with that, I want to thank you so much. If you have any questions, please feel free to contact me. My name is Mari. My email and phone number is listed here below. All right, have a great day. Take care.